Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, I am honored to welcome Dr. Joy Poskozim. Welcome, Dr. Joy. How are you?
Wonderful. How are you?
I'm great. So I introduce you as Dr. Joy Poskozim, and you are the owner of a dental care clinic in Chicago, Illinois. Let's start off a little bit with why dental care matters for the topics we cover here at All Home Care Matters.
Absolutely. Well, it's really difficult to eat without teeth. So, and as we age, we want to be able to eat what we want, within reason, of course, but without the ability to chew, without the ability to eat, it's very difficult to have proper nutrition. It's very difficult to maintain our immune systems, especially if we are, as we age, become more immunocompromised, where we potentially have a problem with one of the comorbidities of chronic disease. Anywhere from COPD to diabetes. These things really affect our immune systems, wreak havoc on them, stress them out. And therefore, every more reason that we're eating and we're able to chew nutritional foods. And there's also a social aspect of it as well. We want to be able to smile. I had a patient in a memory care facility, and even though she was in mid-stage Alzheimer's, she needed her upper partial denture fixed, which I had to then take to my lab. She refused to eat with her mates until she had her upper partial denture back. It was that important to her to have a full complement of teeth, to have her smile at all meals. So I made sure that was a rush job. But there's a social aspect of it as well. We want to be able to smile and be confident with our smiles, no matter what the age.
Absolutely. One of the things, with being a caregiver, you encounter a lot of things that you don't expect. You may assume, you may anticipate, but I'm assuming dental care and dental hygiene is probably, like oral health overall, is one of the things that family caregivers may not often give a lot of thought to because they're worried about, maybe blood pressure, wandering with dementia, getting adequate nutrition and, following dietary instructions. What's some of the most common questions, though, that you get from caregivers when it comes to dental care?
Two things. One, the most important one I see is the loved one or their client or patient is complaining of dry mouth. They're very dry, they're thirsty all the time. And over 86% of all medications for chronic conditions cause dry mouth, especially if the dosage is raised, especially if the medication has been taken for over 3 months. So unfortunately, that is a major problem. So what can I do for my loved one, who's constantly dealing with this and now even having a difficult time swallowing? And so that's a big problem. And then the other problem that I see a lot is bad breath. And guess what? They correlate. They are pretty much one and the same problem. When we have less saliva in our mouths, our oral bacteria, we all have oral bacteria in our mouth, but they become more opportunistic. Our saliva really helps spread them out, keep them mobile. When the saliva, isn't there, where we either have poor quality of saliva or we have poor quantity of saliva, or unfortunately both, then we really do have a problem with both of those ailments. And so I do recommend over-the-counter products a lot. Fortunately, at this stage of the game, we have a plethora of wonderful over-the-counter products. And say what you want about Amazon, but you can get these, products through Amazon on a subscription service. They tend to be cheaper. And the idea is just being consistent with it. And so for someone who, like you or me, we can rinse, we can spit on a daily basis, twice a day, every day after we brush, then I recommend, an ACT like fluoride mouthwash that is safe and effective. It's a dry mouth mouthwash. It's in a white bottle. It's fantastic. And then there's one product over the counter that we can swallow, and it's the Biotene, Biotene. Biotene did split from its parent company, so it doesn't have the enzymes anymore like it used to, but it is still a swallowable product. It is still wonderful. And what's so great about it is that it never reaches our gut. So it's even more, it's really important to think about that it's not going to interfere with any medications that they're on. It's not going to it's not going to cause tummy problems. And it also comes as a toothpaste. It also comes as a gel. And I got to be honest with you, in the dead of winter, I'm using that gel. It's in my car all the time. It's great for the lips, and it's really great to help support keeping that mouth moist.
Okay.
And so those are the two biggest problems that I see, but they're pretty much one and the same.
Do you ever have people that, they're afraid to approach their loved one for, their oral care because they might get aggressive or they're worried about getting bit? And I'm kind of thinking about, caregivers that, want to practice good oral care for their loved one, whether it's, the lollipop swabs or, an appropriate toothbrush or even just using their finger.
Yeah.
You might have some tips on the best practices, but what can the caregiver do when they're meeting that resistance to brushing teeth?
Brushing teeth does not have to be done in the bathroom. If someone is becoming resistant, especially if they are dealing with sundowning.
Mm.
So let's say they have dinner at 5 o'clock, right? They're sitting at the dinner table, they have their dinner. Immediately following it, what I learned as becoming a certified dementia practitioner is that you follow an action that they're focused on with another action, keeping that focus, not letting anything slide or slip. So immediately having the toothbrush, toothpaste right there and following the brushing, drinking some water if applicable, and then brushing the teeth immediately afterwards. That tends to be very helpful. I have gotten really great caregiver feedback saying, oh my God, this is working. We're not waiting until they're tired. We all get cranky when we're tired, right? We're not waiting before immediately they go to bed. We're not waiting until, we go have them go to the bathroom, toileting and then, putting them to bed. No, do it immediately afterwards. The only thing they'll be consuming afterwards, if anything, will be water. And now it's done. Now that dinner has been cleared, anything that's left remaining in the mouth has been cleared out. In the morning, let's say, you can do the same thing at breakfast, or, if that's just not, possible, they're sitting in their comfy chair, they're watching TV, or they're playing with a puzzle. Bring the toothbrush and toothpaste to them. Have them brush their teeth right in their comfy chair. This is where they feel the most comfortable. This is where they feel the most stable. And then I also recommend tell, show, do. We learn this in dental school for our kids, for our pediatric patients, but we also have found that it is incredibly helpful. We want our patients, we want our loved ones to feel as much in control as possible and to be fully aware of what's going on at all times. So you show them the toothbrush, you tell them you're going to brush their teeth, and then you point. Mom, I'm going to brush your upper right side now. I touch the outer part of the mouth. And then I brush there. And maybe we'll do a hand over hand technique so they feel like they have some control over the situation. I then go and do the lower. And even if they're clenching their teeth like this, at least we're getting the outside of the teeth. We're still getting 50%. We try to go back as far as we can on both sides. We don't want those last teeth becoming garbage dumps, collecting everything we pushed along the way. But even if, like I said, we're only being able to get the outside of the teeth, I'm okay with that. It's been done. Routine has been established. We're keeping up with these routines. If we're consistent with this, then we should have a better chance of getting these teeth brushed. And one last thing, we never want to be talking down to them, either physically or even just socially, correct? So when I do this, even if the loved one is in a wheelchair, I am kneeling down or I am knee to knee with them so that not only are we making eye contact, but we are of the same level. We are equals. And so therefore, I want to make sure that we are at the same level. I'm not going down to them, because anyone coming down to me, what am I going to do? I'm going to deflect. I'm not going to want this. But if we're on the same page, if we're on the same, we're meeting at the same level, much better response.
Yeah, no, and that's great advice. And, we often, the families that we serve, Dr. Joy, is they face obstacles to even getting to the grocery store with their loved one or picking up a prescription, let alone their, regular medical checkups. When do you recommend families consider having a dentist come to the house versus continuing to try to have those in-office appointments?
That's a great question. When the loved one is no longer really able to sit in the dental chair. So we've got the physical part of it, right? A lot of dental offices, I'm not going to lie, have a problem in being able to wheel the dental chair into an operatory where the dental chair is. And then a lot of the staff do not know how to properly transfer
Right.
the patient into a dental chair. So we're dealing with a physical problem. A lot of times, the dentist will oblige and then take care of the dentistry and the dental and the wheelchair, especially with the new modern ones that can tilt back. Some of them are absolutely fantastic. And then we'll do the dentistry standing. Completely understandable. But if sitting in a chair is really going to be a difficult uh, block to getting proper dental care, maybe it's time to seek care to come to the home. And of course, then we of course have the mental capabilities. Are they going to be able to understand that they're in a dental office? Are they going to allow a stranger, even though this may have been their dentist for the last 20 years, are we going to allow this dental hygienist, this dentist, to touch them? Especially when they've been disruptive from their daily routine, especially when they are not familiar. And so now they're not in their comfort zone. And now you expect to have this patient lean back, have suction. No, that may be a really good time to say, you know what, I think this patient would be better served in the comfort of their own home in their easy chair.
How about when that time does come and the family makes that decision, or maybe it's their own dentist recommends, maybe going forward you need to look into having these, dental cleanings and, appointments at the house. Where do you recommend people go to find dental practice that will do house visits?
Absolutely. They can go to their state dental society, and every state has its own dental society that you can find online and you can call. And some states even have them listed. Another opportunity would be going to this Special Care Dentistry Association. And you can find that online as well. You can Google Special Care Dentistry Association. You do not have to be a member. You do not have to log in. On the top part, you're going to see find a dentist, and you can literally find a dentist based on county, state, city, zip code. And, having done this over the years for other people that have moved, right? They've either moved down to Florida or having come back up from Florida into another state. Dr. Joy, can you help me out with this? We're moving. I have always been able to find a dentist that will come to the home. I will want to be specific, though. There are two types of dentists that come to the home. We've got the house call dentists and we've got the mobile dentists. I'm a house call dentist, which means I park my car and I go into the home. And then there are the mobile dentists. They're the ones that have the mobile vans. I will say the mobile vans they're amazing. You usually have two operatories. You can do everything in there from root canals to implant surgeries. I mean, they're phenomenal. That being said, my memory care patients aren't going to want to leave the house. When I'm, in downtown Chicago, there is no way we could accommodate for that, right? So I'm a house call dentist. Trust me, you don't want me driving a Winnebago by any stretch of the imagination. So I actually will park my car. I go into the home. So when you are looking for a dentist, that comes to the home. If you feel that your loved one can make it out, into the driveway, or if you are in a suburb or if they can come out, fantastic. Then a mobile dentist is the way to go. However, if your loved one is in hospice, is bed bound, is a 5-floor walk up, been there, done that, then you really want to make sure you have a house call dentist. And so you want to be specific in what you're looking for.
Yeah. Now, when patients go, or they take their loved ones, either they have that house visit or they're leaving the office, sometimes I'm sure, offer a prescription for something they may need. But then, like you've mentioned some of the products, there's over-the-counter products that are very helpful and supportive as well to good dental hygiene. Are there any special over-the-counter products that you recommend for people's loved ones? You know?
Yeah, so it's interesting. It really goes back down to how their saliva is, and I really want to make sure that, for example, for women as we age, we may get Sjögren's syndrome, where we don't have tears, we don't have saliva. So how can we help keep that mouth as comfortable as possible? I'm a big fan of lozenges and sugar-free lozenges. I've just had a patient in my chair. He's older. He's had chronic dry mouth for most of his life because he's got asthma and he has to give himself nebulizers twice a day. So his mouth is very arid. And
Right.
not from lack of trying. The guy tries really hard with his oral hygiene. Kudos to him. But at the same time, he's been sucking on lifesavers. I had to do a lot of work on him that day. It's unfortunate because those lifesavers are full of sugar. So we really have to be careful of what we're, giving our loved ones or what we're using ourselves. So I like lozenges, sugar-free lozenges, especially because you're sucking on them, or even sugar-free lollipops. You're sucking on them, and that's helping to produce saliva. And it may not be the best saliva in the world, but you're producing it. We've got the gels, we've got sprays anywhere from Oasis to the all day spray. There's so many of them that are out there. They're all good. I'm not going to lie to you. It's really difficult to find a bad one. They all serve a purpose. It's just the finding which one you like the best taste of, or does it even have a taste at all? How does your loved one feel about that? How do you feel about that? And then also making sure you're using them consistently. So if your loved one can no longer suck on a sugar-free lozenge, and then you found that sprays are better, you just want to make sure that even though it's over the counter, you are using this as a medicine. You're trying to help a chronic condition get better. And these products have an additive effect. So the more often you use them, the better they work. So example, breakfast. We're going to have some water. I want to make sure that mouth is somewhat moist. We can do a spray, right? You can spray the tongue, have your loved ones, stick their tongue out if possible, spray their tongue, try to get under their tongue, try to get the roof of their mouth. Even if you can, try to get their back of their throat. We want that mouth nice and moist for them to be able to consume food, right? We don't want any choking. We don't want them to spit food out because they feel that they can't swallow it. We don't want them hoarding food because they're pushing it over to the side because they feel they can't swallow it, also known as pocketing or squirreling. So the good news is that there are wonderful products that are out there. I really am a big fan too. He is a retired dentist based in Michigan that makes Dr. John's Healthy Sweets. And if you put that into Google, Dr. John's Healthy Sweets has a huge dry mouth collection, if you will, of lollipops, of lozenges. They're all delicious. I know. I've tried them. I always test product first before I, give kudos to them. But they are wonderful. They are nominal in price. They are no more expensive than anything that you would find at a Walgreens or a CVS or a Walmart. And they have a monk fruit in them so people that have IBS issues or Crohn's disease and cannot have xylitol, they make them in those flavors as well with that type of sweetener. So it's safe, they're effective, and they taste good.
That's great. Dealing with people with physical limitations, and then some of them on top of that are dealing with the cognitive issues like a dementia diagnosis. Families face uncertainty sometimes at any given time of day or night, but especially for people dealing with dementia and, facing sundown syndrome. What do you recommend they do if, like at bedtime, they're wanting them to, get their teeth brushed so they have that good hygiene and they're dealing with sundowning? What can you do to help get them to brush their teeth during that phase?
I kind of touched on this earlier, following an action with another action, but I will also say too, is, giving them a toothbrush. And even though they might not even be bringing it to their mouth,
Yeah.
Having them hold a toothbrush, once again, there's a sense of control. There's a sense of they're helping, right? Oh, you're holding a toothbrush, I'm holding a toothbrush too. And then either having, you bringing that toothbrush to their mouth, and then you're doing it with the tell, show, do method, or they're just holding it and now you're brushing their teeth. And honestly, if you've got a night where, it's been like today, it's cloudy, it's rainy, it's dark, right? Sundowning may happen, as early as, 2, 3 o'clock in the afternoon today, right? And then, we have to have dinner. Maybe you're just not able to brush that night. If we can give them a lot of water to be drinking, even if you're using thickeners, if you're at the stage now where you're using thickeners, just trying to get as much down as possible, and then say, hey, mom, I'm going to do a quick check in your mouth to make sure there's no food in there. And how to do it without getting bit is, once again, your eye level with them, your knee to knee, you're touching the side of the face. And what I do is that I do this. I hook my finger around and around. They can clench and grind all they want, but as long as my finger is right on the inside of the cheek, they can't hurt me. So you were talking about earlier of fear of getting bit. That is a perfect way to make sure that you can look straight in the back there to make sure there's no food. And then you can use one of those swabs, or you can even use your other finger. Mom, before you even just start doing it, Mom, you've got some food in there. I'm going to try to take that food out. Okay. And then you do it. Tell, show, do. And then you go to the other side. So even if you can't, there is no way you're going to get a toothbrush in the mouth that, like a day like today, perfectly understandable, but at least check the mouth to make sure there's nothing in there that they can choke. And it can vary day to day, where one day they haven't, there's never been a situation of pocketing food or swirling food. And then all of a sudden, it starts to happen. So it's something that needs to be, oh, my mom doesn't do that. Well, maybe not yet. And she may never. Everyone's different, but it may become a situation where this will start. And this is something that will have to become of your regular routine. If you do start seeing pocketing food, maybe you want to start changing that food. Maybe they don't feel comfortable in swallowing anymore. And so maybe that's, a type of food or type of meal that you may have to cross off and not give anymore, to help control that situation. But if it's their favorite food, you do what you can. You compromise, right? But you always still want to be making sure. And even if you're taking food out, and if they're amenable to that, I would still then try again to brush. If you're able to get your hand in there, and maybe you are able, even if it's just side to side and they're done, I'm okay with that, because at least you've tried, you've gotten that toothbrush in there, you've gotten more junk out, and it's better overall for the mouth.
Dr. Joy, I want to, before we go to the next question, I want to just follow up something that just came to mind. We do a lot of educational dementia series and seminars in Michigan here, and families, one of their biggest complaints are always, my mom, my dad, all they want to do is eat sweets and eat candy and eat chocolate. We both know that the last taste buds to really go are your sweet taste buds, so that's why they're more attracted to that. But that's got to be really horrendous on your dental care and your dental health. How do you
those Werthers? I see Werthers everywhere. Yeah, and you think they start making them sugar free? Maybe we need to get a group together. Start a petition.
Well, and Tootsie Rolls and things that that really sticky stuff.
Melted milk balls.
Yeah.
I could not agree with you more.
What do you?
Walgreens has a really good. I don't know if Walgreens is in everywhere, but Walgreens tends to have a really good sugar-free section where you can get sugar-free candies. But I'm going to go back to that Dr. John's Healthy Sweets again. I've got to tell you, not only do they have a section on dry mouth products, but they also have fantastic chocolates. They have fantastic other sweets that are just amazing, and they're sugar free. They're either with the xylitol or the monk fruit. I've tried them. I personally cannot taste the difference. So by having that in the house, instead of Yeah, okay, now you got to order it. Now you got to wait for it. Okay, fine. But at the same time, it's one less trip to the store. And number two, you can know that this is safe for the entire family. I'm the best auntie in the entire world because I always send Dr. John sweets to my loved ones in Texas for Thanksgiving, for Christmas, for Valentine's Day, for Easter. I'm sending them these candies because I know they're safe and effective, and it's a great way for me to bond with them. Oh, my Auntie Joy. But I also know that, they're not going to hurt the tummy, and they're also not going to cause cavities. So there's something to be said about that company. They're really fantastic. I love their customer service. But even if you're just, a Walgreens or a Target or a CVS, you should be looking for the sugar-free products. You're not going to be able to really find so much for chocolates, but when it comes to other types of candies, always sugar-free. And yes, you're right. Mom is 89 years old. She should be able to eat what she wants. Yes, but she also should not develop at 90, a toothache, which
Sure.
can still happen at any age.
Oh,
They really can. Or teeth will get decayed. We don't feel it anymore, and the tooth can break off.
right.
Oral bacteria are like termites. So they're going to burrow themselves into the tooth, right? They're going to burrow themselves into the tooth, kind of niche around the tooth, the neck of the tooth, if you will. And now there's no support for it anymore. They bite into, I don't know, something as soft as, a cooked carrot, chicken pot pie, and that tooth can break off. And it's because there was decay, there was oral bacteria that had burrowed themselves all around the outside of that tooth and worked their way in. Why? That can still happen at any age. In fact, it's even more prevalent for those who are suffering from one of the types of dry mouth. And so we should be even more diligent and more persistent on what we're giving them to satisfy that sweet tooth.
Yeah, absolutely. You know, people often, they want to maintain independence for their loved one as much as possible and respect their autonomy. And I completely admire and respect that approach. Sometimes it's possible, sometimes it's not. But how can caregivers and family members empower their loved ones when they're trying to brush their teeth? Such as help them hold their toothbrush or, things along those lines.
So I let them brush their teeth first. Whenever I'm in a home or a long-term care facility or community, I always want to make sure that I'm taking care of them in their rooms. First of all, I'm a guest in their home, so this is where they're going to feel the most comfortable. And then I'd like to be there after a meal. I like to be there after breakfast. I like to be there after lunch because I want to see how they brush their teeth afterwards. And it's a good excuse to brush. Well, Sally, you just had lunch. Let's brush our teeth. And usually, they're amenable up to a certain point, right? And then it depends on the person. But I want to see how they're brushing their teeth. If they're only doing one side, okay, fantastic. Well, then maybe I'll once again tell, show, do. Sally, you're brushing that left side so well. Let's try to bring the toothbrush over to the right side. And then they might want to go back to the left. Well, then I'll, once again, tell, show, do, bring it back over to the right, and then help them with that. Other times, what I'll do is I'll just let them brush for as long as they want. As long as they want. The longer the better, as far as I'm concerned. And then I am monitoring. I'm checking to see, are there areas that they miss? Are they only brushing their front teeth? Well, that means that I need to go in the back. I need to really check the back. Because if this is all that they're doing, then we know that those other teeth aren't being brushed. They are not being taken care of. So if a loved one can still brush their teeth, I would still monitor. I would, as their daughter or, as the caregiver, I would still be monitoring. I just wouldn't be handing them the toothbrush and walking away. I really want to make sure they're doing a good job because, when I come in there and I see those front teeth really clean and I see those back teeth caked in plaque, I know that number one, the caregiver isn't brushing their teeth. Okay, fine. That's where I come in to show how with this particular person. It's all personalized. Or it means that they are not monitoring them on how well they're brushing, and there's been no gentle reminders of where that toothbrush should go next.
Right. That's great advice. And we've talked about teeth, but let's talk a little bit about dentures because, I know a lot of our seniors and our elderly, they either get, a plate or they get full dentures. What if they don't want to wear those dentures anymore? Like,
Oh my
how do
gosh.
you, especially, for our loved ones that are facing, cognitive issues, dementia, memory lapse, how do you get them and remind them, especially if you're not living with them and you're, in a different home altogether?
Yeah.
They're
No, it's tough.
experiencing.
And I got to be honest with you. It's one of the toughest conversations I have with the families. So I'm going to be asking questions. How long has it been since they've worn them? What did they take them out and refuse to wear them? Or were they taken out one night because you're supposed to and have them soak in water? And then the next morning, they're not putting them back in. What's changed? Is there pain in the mouth? Is there, are they not putting it in because they're may, they maybe have pain? Or, if it's a partial denture where it was attached to other teeth, did something happen to one of those teeth? You put it in their mouth, you might not even notice it, but it's not hooking right. And so now they can't tell you. They may not be able to communicate with you, but they're taking it back out because it's not fitting right.
Yeah.
So that's another possibility. So one is their pain. Two, with partial dentures, is something broken? Did a clasp come off? Did a tooth break off? Especially in the back, these aren't things we're looking for all the time. And so that's when you would be able to call in a dentist and say, hey, what's going on here? Why isn't, Sally putting in, her denture anymore? But there's also a third possibility. And the third possibility is they just don't care. With Alzheimer's comes apathy. And especially in late stage, they just don't care anymore. And that's when I start to ask questions about thriving. Are they still eating okay? Has there been any loss of appetite? Has there been any loss of eating? Have they lost weight? If none of those are happening, maybe they're just happier right now without the denture. And yes, that may be a really tough pill to swallow because, as a loved one going in to see mom and she doesn't have her upper denture in anymore, it's kind of hard to look at. And I totally respect that. It's such a tough conversation to have with my patients' families because if they're happy, if the patient is happy, patient comes first.
Right.
If the patient is happy, I'm happy. So if they're eating okay and they're happy as a clam and they are living their best lives as is, keep it that way. Don't force the issue. There is a reason for them to not be using them anymore, and I'm okay with that. Now, that being said, if there is a problem where they're no longer thriving, where they are dropping weight,
Mhm.
okay, let's try to get that denture back in, or we need to start thinking outside the box when it comes to nutrition. We need to start thinking about maybe an insure. We need to start thinking about, what else can we be doing to make sure that this person keeps up their nutrition while no longer chewing their food. So it's a conversation I have. I like to consider myself an integrative health dentist, and that's not just for my patients in my practice where I work 2 days a week. It's across the board. My other 3 days when I'm going into homes, where I'm talking to dietitians, I'm talking to the nutritionists, and like, okay, this person we've noticed now, we're taking the weight now once a week. What are we feeding them? What meal plan do they have? Are they on a pureed diet? What can we do to help beef them up a little bit so they're not failing to thrive? So it really takes a village at that point to make sure that this person is still living their best life while eating appropriately and maintaining nutrition and proper weight.
Yeah, no, absolutely. Just real quick for our viewers and listeners who may be wondering this question, how does that affect their insurance coverage if they at some point have to or they're interested in having the dental care at their home rather than at the office? Did it?
Great question. Yeah, no, that's a great question. So if someone, is a former union member, for example, or teacher, or that has dental insurance still, how we handle it, and everyone is different, but how we handle it is that, yes, we are in network with all PPO dental insurances. I will say in the state of Illinois, HMO dental insurances will only pay for a patient in a dental office. They feel that is where the best care is provided, and that's how they're only going to use that or be able to use that HMO insurance. It's unfortunate, but there you go. But back to what we do is that we will take on a credit card. We will charge the credit card at time of service or the following day, whatever, and then they get directly reimbursed by their insurance. So that's how. So it's called direct reimbursement. We get paid first. They get paid by their insurance company. So that's how we handle it. But every dentist may be different. When it comes to Medicaid, it really does depend on the state. I'll be perfectly honest with you. I am not a Medicaid dentist. And the reason why is because we don't get paid for, once again, being in someone's house. So that's unfortunate. It's just, maybe, I don't know if that's across the board. I definitely know that's the way it is in Illinois. So I do sliding scale. And, for me, I'll be honest, if I'm seeing more than one person in a, let's say, memory care community, I'm charging $175 for the cleaning and exam. I'm not asking for the world. I want to make sure, though, that I'm also talking to it within that. It's not just looking at their mouth, cleaning their teeth, and walking on. I want to make sure that the caregiver, whether it be a personalized caregiver or the floor caregiver, knows what's going on in that person's mouth. Hey, by the way, did you notice that Jane is no longer brushing her teeth anymore? You're going to have to help her. It's no longer a monitor situation. I break it down into 3. Gentle reminders, usually for our assisted living or for those who are living at home, gentle reminders plus monitoring to making sure they're brushing their teeth. And then with end stage, that you're brushing their teeth now. So there's a lot of education that I provide per resident, because once again, everyone is different, and how they're going to respond even per day, right, is potentially different. So I give them options, but that, generally speaking, is what I do.
No, that's great. Just one final question here, Dr. Joy. Fall risks are one of the leading causes of injury in the home. And when you're already dealing with a vulnerable person, limited mobility, poor ambulation, but you're wanting to get that hygiene for their mouth, that oral care provided. I know you mentioned earlier, and I fully agree with you. You don't have to brush your teeth in the bathroom, but if someone does have a loved one who is a fall risk and it's hard to get them to brush their teeth, what do you recommend that they do?
So generally speaking, I will ask, where do they spend most of their time?
Mm-hmm.
Where do they spend most of their time? In the living room? Do they spend most of their time in the bedroom? Where do they spend most of their time? And so these are people that are living, in the home. This is where they feel the most comfortable. This is where the routine is. I'm bringing the toothbrush and toothpaste to them. And once again, I want to follow an activity with another activity. Yeah. So let's say they've had lunch and they're not wanting to brush their teeth. You've done a puzzle with them, or you've colored with them. You're following activity with another activity. Okay, yeah, fine. They're sitting at the dining room table. Let's brush. Mm-hmm. It's just another activity. We don't make a big deal about it. We like, okay, we've colored now. Now we're gonna brush the teeth, and just it's part of the routine. And if you try to have it to be at the same time every day, like when they had their meals, we automatically do this. It seems to be way more effective, and the resistance seems to be prolonged because this is of course, this is what we're going to do. This is routine, and also what I like to do too is I like to tell the families, have the toothbrush and toothpaste sitting right there. So like, let's say they're having a bowl of soup, right? But the toothbrush and toothpaste are sitting on the table. They can see them. So they've known that this is going to be the next step. We're not bringing it to them and making a big production out of it. It's already there. It's part of the process. It's part of the day. As we try to keep it as normal as possible, then and they're sitting down anyway, fantastic. For our wanderers, yeah, it's going to be a little more difficult. Maybe we're brushing their teeth when they're already in bed. They've got their comfy, they're all supported with their blanket. They feel comfortable. They feel safe and secure. Brush their teeth in bed. Big deal. If you're doing that first thing in the morning before they get out of bed and last thing at night, I'm okay with that too. If you only do it in the morning, ideally we wanted to do it, twice a day. But for our wanderers, those that, are living with Lewy bodies, for example, then yeah, okay. So we're doing it in bed before they even get out of bed. You catch them before they get up. And that way that, we can at least try to have, once again, establishing a routine that potentially, I've actually had this situation. They don't get out of bed until they brush their teeth.
Wow.
Yeah. True story.
Routine, right?
Routine.
Yes. Where would you like for viewers and listeners to go to learn more about you and the work you're doing?
Absolutely. So please feel free to use me as a resource. Ask away. I love helping out. We all help each other out in this world. We all need to help each other out when it comes to our loved ones, no matter what they're living with. And so the best way to reach me is by email. So I'm going to spell it out for you. It's my initials. So it's J, V as in Victoria, P as in Paul, Dent, JVPDent at gmail.com. Email away. I would love to have your questions. Please, whatever I can do to help and solving them, I will definitely try.
Absolutely. Do you want to shout out your website as well?
Yeah. So my website is joyfuldentalcare.com. And it's just one L, joyful. They don't teach marketing in dental school. So you got to work with what you got. So it's joyfuldentalcare.com. It's really simple. I've got a huge section on oral care and senior care and all that. And you can also email through the website as well, if you so choose. I will get it. It comes to me. It doesn't go to anybody else. All emails through my website comes to me.
Wonderful. And we'll have that also up on the screen for the people watching this, as well as in the show notes. Dr. Joy Poskozim, thank you so much for your time. And, really the advocacy you're doing, I think, is phenomenal. We see countless families here in Michigan who are in their home, who are in facilities that we're taking care of. And of course, our staff helps them with their oral care, but we're not dental practitioners either. And I really would wonder how many actually see their dentist regularly for cleaning and for checkups. So that you're offering this service and just bringing an awareness that this service is even possible, I think is just tremendous. So thank you so much for being with us today.
Thank you for having me.
Have a great day.
You too.
Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms, or you can watch the show on our official YouTube channel. Just make sure that you hit that subscribe button so that you never miss an episode. We'd also like to say thank you again to Dr. Joy Poskozim for joining us today. We look forward to seeing you here again next time at All Home Care Matters.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.